All right, it is Thursday, so we turn our attention back to medicine. Today we have Dr. Michael Robinson here from New Hanover Regional Medical Center. This is Cervical Health Awareness Month, so he's here to talk about the risks of this. We were just talking about family life and kids. Do you have daughters? Or
I do not. I have two sons.
So I have daughters, and one of the things we talk about is this, not specifically cervical cancer and things like this, but the HPV virus.
Yes.
With the inoculation you can get for that. But let's start with cervical cancer itself. Fairly rare cancer, correct?
It is rare. Worldwide, it's still one of the most common cancers. In the United States, we've really seen a drop in the incidence since about the 1970s, about 50% or so drop, and that's really because of the screening with the pap smears that we've been doing. So even though the incidence has dropped a lot, it's still relatively prominent, and in 2019 the American Cancer Society predicts that we'll have about 13,000 new cases with 4,000 deaths, so it's still pretty significant.
Yeah, so it's rare but can be fatal.
Exactly, yes, it is.
So obviously with having daughters myself, this will be something I'll be mindful of going forward. At what ages do we start screening for this?
So typically screening will begin about 21 years old. The guidelines have changed over time, but we know that women younger than that are very unlikely to have cervical cancer, so 21 is now the limit to start.
I mentioned HPV with, now there is medicine that, that children, and it's not just girls, boys and girls can do this and start early to help prevent something that later in life can really come back and haunt them.
Yes, so cervical cancer is the only cancer that has a vaccine to help prevent it. The one that's used now, there have been a couple on the market. Now we have the Gardasil 9 that was initially approved typically between 11 and 26 years old. You can go as early as 9 years old in higher risk groups. Most recently in October, the FDA changed that, and now they are offering it up to 45 years old based on some new studies. So we encourage people who have not had it before, who are still 45 or younger, to get the series.
And that's a, as I said, it's a series of shots, not a one-time deal.
Two or three shot series over the course of about 6 months to a year. Yeah.
When you're dealing with the type of medicine that you're in, what do you think is the biggest misconception? I know with men, we are we're the ones that don't go to the doctor. Women typically go more than us, but what is a misconception about?
So, yes, I agree with you. Women are better than men, and I'm not a very good patient myself, so I can attest to that. But especially when you're thinking about going to a gynecologist, it's not necessarily the most pleasant experience, and it's hard to encourage women to do that. And now that we have guidelines for screening with pap smears that are, sometimes 3 years, sometimes 5 years, women hear that and they think, oh, I don't need to go see my doctor that often. Really, what we want to encourage women is to see their doctors every year, whether it's their gynecologist or their family doctor who's comfortable doing pap smears and screening. Because that is really the best way to detect any abnormalities in the cervix, and then we can sort of tailor the screening based on their previous pap smear history, their previous medical history, and the type of test that we're doing. Yeah,
and we always say, folks do have questions. I've answered the phones here before. Don't call me. You always want to talk to a doctor. I'm not the guy that's going to, help you with this. And as you pointed out, start with your own general practitioner to have some questions answered before maybe moving on.
Absolutely.
Appreciate the time.
Thanks so much, Rob.
Welcome to Wilmington as well.
Thank you.